Welcome to the Connecticut Health Policy Project's video primers on Connecticut's healthcare system. This third session is about the costs of healthcare. Are we getting what we pay for, and what can be done to control costs? Healthcare drives Connecticut's economy. 12 cents of every Connecticut dollar is spent on healthcare, over $30 billion in 2009. 1 in 8 workers in our state is employed in health services. While Connecticut employment dropped 4.3% from 2008 to 2009, healthcare employment was up 1.7%. 10 major drug companies, 22 biomedical companies, and 6 major insurers have large facilities in our state. Healthcare in Connecticut is expensive. Per person spending on healthcare is 27% higher in Connecticut than the rest of America. From 2001 to 2011, total family premiums in Connecticut rose 85%, while household incomes rose only 23%. Under any scenario, healthcare spending is expected to rise well into the future. The United States devotes more of our economy to healthcare than any other country, 18 cents of every dollar, 50% more than the Netherlands, the next highest. Unfortunately, we aren't getting our money's worth using virtually any health measure. Our life expectancy is below Chile, Korea, and Slovenia. The quality of care we receive does not reflect the high prices we pay for it. Only half of Connecticut adults over age 50 get the recommended screenings and preventive care they need to stay healthy. Almost 1 in 5 Connecticut residents with asthma each year has to visit an emergency room for care. And 11% of Connecticut hospitalizations, costing $1.2 billion each year, could have been prevented with better access to primary care. In addition to rising costs and eroding value, the source of healthcare funding has been shifting from private coverage to public programs. Very soon, taxpayers will be funding more than half of all healthcare in the U.S. There are several forces driving health costs. Healthcare is expensive in part because too many of us don't have insurance coverage. People without insurance don't stop getting ill. They just have trouble paying for it. That inefficiency adds $198 per year to single coverage in Connecticut and $583 to Connecticut family bills. Another driver is that as a population, we have growing health problems. The rising prevalence of the top 5 medical conditions accounts for almost a third of the rise in health costs. Our lifestyles are also driving costs. Obesity accounted for 22% of the rise in per-person health spending from 1987 to 2009. Our fragmented system and the resulting inefficiencies are also a drain on the economy. Administration consumes 31 cents of every dollar spent on healthcare in the U.S. In contrast, Canada devotes less than 17% of their healthcare budget to administration, leaving more resources for medical care and prevention. The Congressional Budget Office credits new technologies, new drugs, procedures, and devices with almost half of rising health costs. Some medical advances are critical to promoting health, but some have little to no value. The problem is that there's not enough comparative effectiveness research on which is which. Another important driver of rising health costs is waste, duplicated services, unnecessary treatments, and inefficient administration. It's no use carrying an umbrella if your shoes are leaking. How can we control mounting health costs? There's no shortage of options for Connecticut to rein in healthcare spending without sacrificing quality or access to care. The Connecticut Health Policy Project has collected 31 options, large and small, easy and hard, long and short term. All are being used successfully in other states and in different systems. An important tool to lower healthcare costs is to prevent healthcare problems in the first place. Improving physical activity, avoiding obesity, and quitting smoking can reduce annual health costs between $1,500 and $2,500 per person. Only 30% of U.S. employers have any health promotion programs. We can reduce unnecessary treatments that are consuming scarce resources and harming our health. Provider groups have joined the effort through the Choosing Wisely campaign to identify dozens of treatments that should be sharply reduced. Investments in comparative effectiveness research and follow-through in payment policies will improve health and control costs. Reforming how care is delivered is critical to lowering health costs. Patient-centered medical homes coordinate care, engaging a team of providers to help people keep themselves healthy. Health information technology and electronic medical record keeping will improve care coordination, improve patient safety, and make care more efficient. It's critical to align incentives for providers to pay for quality care rather than rewarding more and more care. Transparency is key to controlling costs. Consumers have no information on what health services cost or the quality of care they receive. Given information, consumers can help drive more efficient care with their choices. Finally, the healthcare system must remove any conflicts of interest in healthcare to ensure integrity and reduce unnecessary spending. For more information and videos on Connecticut's healthcare system, visit the CT Health Policy Project website. For updates on healthcare in Connecticut, follow our CT Health Notes blog. And for more resources on Connecticut's healthcare system, visit cthealthbook.org.